in anticipation of Manitoba's official request for additional support to manage the situation, we're preparing to deploy federal health human resources. We're also looking at deploying medical staff through the Canadian Red Cross and sending support from the Canadian Armed Forces.
COVID's third wave is overwhelming Manitoba and forcing the provincial and federal governments into action. Medical staff from across Canada are heading to the nation's middle province with the promise of more help on the way.
The COVID-19 situation here in Manitoba is serious. We are experiencing surges, more variants of concern, and climbing ICU rates. Our healthcare system is reaching its limit.
With some of the highest numbers of new COVID-19 cases in North America, 12 ICU nurses are already confirmed to be heading to Manitoba. In the meantime, that province has already been transporting intensive care patients to Ontario. Looking at statistics, Manitoba's positivity rate is 13.8% over the last 5 days. By comparison, Canada's is closer to 4.1%. But Manitoba's Brian Pallister rejects claims the province hasn't done enough, saying the problem is ordinary Manitobans ignoring public health orders.
When people don't go and get tested when they have COVID, who else am I supposed to talk about? When people go in and don't cooperate with a contact tracer and provide information on who they've been in contact with, how the hell are we supposed to stop people from getting COVID?
Meanwhile, the federal government remains confident Canada's Moderna contracts will come through, which would help with vaccination numbers across the country. Procurement Minister Anita Anand says she had good talks with Moderna Tuesday morning, but is still waiting on a clear delivery schedule.
We are in very serious and active discussions with Moderna right now about the deliveries to come in the month of June, July, and August.
And finally, there is an update on the Johnson & Johnson vaccine. The 300,000 doses first shipped to Canada last month are still being held, and no further shipments will come in until Health Canada and the FDA finish investigating the Baltimore plant that may have contaminated those doses. In Ottawa, Xiaoli Li, City News.